Hello, everyone. Welcome to Know Your Number, a five-part podcast series on VO2 max, longevity, and smarter training. I'm Marco Meucci. I'm the academics manager at Cosmed USA, and I'm joined by Dr. Ilan Kedan, cardiologist and founder of Cardiolucent in Beverly Hills. Dr. Kedan's practice focuses on precision heart health, preventive cardiologist, and the use of advanced tools to help patients understand their cardiovascular risk and performance in a more precise and personal way. Today, we are starting with the basics, VO2 max. What if one number could tell you how well your heart, lungs, blood, and muscles work together? That's VO2 max.
That's right. Thanks, Marco. Thanks for the introduction. I'm very happy to be here, and I'm grateful for the opportunity to talk about something that's very valuable and important to all of us as humans as we age. And VO2 max is one of those numbers, as you were saying, that really was kind of identified in the sports science world, but has become now something very valuable in assessing everyday health, fitness, preventive health, longevity, health span, and assessment, backward calculating body composition as well.
Yeah, so let's start simple here. Tell us, Dr. Kedan, when a patient asks you, what is VO2 max? How do you explain it?
So it's a good question. And VO2 max is a measure of how well our bodies can extract oxygen from the air when we are exerting ourselves. And max is like the maximum amount. So the maximum amount, if you were to kind of use an analogy, the maximum amount of food that you could consume at a particular time at the buffet, it's kind of the similar analogy as the maximum amount of oxygen that your body can efficiently exchange during exercise, during maximal effort. So it's not a measure of only your cardiovascular capacity, but also your muscular gas exchange or efficiency of your muscles to extract oxygen from the blood, and also your lungs in exchanging air, carbon dioxide, and oxygen as you are increasing physical demand.
So you use a wonderful analogy about VO2 max and food. And when I talk to my people, we usually also use the analogy of a car engine. So VO2 max is almost like measuring the engine of your body, as you can use oxygen to oxidize, to burn the fuel, and then you create this exhaust like carbon dioxide, which is the analogy of carbon monoxide. So measuring those gases, you understand how much energy you're actually producing to move your body and where does that energy come from. And so a lot of people think that VO2 max it's just for runners, for cyclists, or just for elite athletes. So, but it's not like that. Tell us, why should the regular patient care about it?
So I like that you use the car analogy. We're kind of a food obsessed culture, so I kind of like skew towards food and eating, but that's exactly right. And your question, what's the value of it? Well, when contextualizing what VO2 max represents, VO2 max is a measure of capacity of your body to perform. And there are usual tasks in our daily life that require a certain minimal level of capacity to do. And that can be translated to a VO2 max or oxygen consumption. So if one were to say, I want to be able to walk up a flight of stairs, that would equate to a specific oxygen delivery or oxygen capacity for consuming. And as you increase the level of complexity and difficulty of the task, the amount of capacity or the oxygen delivery that and oxygen extraction from your body's muscular tissue increases as well. So it's a very valuable tool, especially as we age and in the context of how we are thinking or how often the general kind of zeitgeist of lifespan and health span, what we want to be able to do as we age can be assessed by, a surrogate for how well we can consume oxygen or VO2 max.
That's
So
wonderful because this makes people understand that this number is not just indicating if I can run faster, if I can ride my bike faster, if I can win a race. This also tells you how resilient your cardiovascular system is. It tells about not only performance, but also health and economy of movement. And so one of the questions that many people usually ask us is about measurement versus estimate. Everybody has a smartwatch right now, an Apple Watch, a Garmin watch. So how is that a direct VO2 max measurement differ from an estimate, from an activity tracker?
well, I mean, good question, and it's a valuable question, and it's something that comes up when I have conversations with patients. They say, okay, well, my watch or my wearable tells me my VO2 max is this, and I kind of have the conversation, do you know how they calculate that? And they say, calculate? What does that mean, calculate? Well, it's not a measurement of your VO2 max, it's an assessment based on assumptions, which they use back calculated estimates from 3 or 4 different variables that the watch can collect. And the watch is not collecting gas samples. It's not assessing expired carbon dioxide. It's not assessing the live heart, breath by breath, heartbeat by heartbeat consumption of oxygen. And so maybe it's close, but maybe it's not representative of like actually what you can do when you perform. And I think when we look at the context of the outcomes or the predictors of VO2 max clinically and expected performance, there's really no way to know how well you perform unless you perform the test and we measure your capacity. So when I measure it and when we talk about it and I kind of talk through with patients, I mean, I think it's valuable, especially if it correlates that the wearable has a similar number, but inevitably it's not going to be, and inevitably it's not necessarily going to change as much with training as well.
So in individuals that are healthy, that meet the criteria of the average person based on their age, their sex, their height, their weight, that number can pretty much align with the measured one. But as soon as we move away from the average individual, that difference may become bigger and bigger and bigger. So measuring becomes very important, especially for clinical populations. Am I right?
That's right. And the average person there's a range of average, and every person, when I think of them clinically, is relative to themselves and their best self and their future self, as opposed to a population. So, you don't treat someone to be somebody else, you treat someone to be the best version of themselves. And so having a bookmark or benchmarking someone's capacity from day 0 and looking forward with training effect or medical management or treatment effect, and then reassessing is a valuable tool in helping someone or clearing the path for someone to be or pursue the best version or a healthier version of themselves going forward.
This is very valuable to me, what you just said, because many people want to know, how am I compared to the best version of myself? But they compare the number against people in their group, while instead they should have looked at their own value at baseline, see how they improve based on the prescription they received, and see what is the progress of their value over time. So let's make an example just to give our listener a little bit of practical and applied knowledge. Let's say 2 people could have the same VO2 max number, but the interpretation might be different depending on age, depending on symptoms, history, goals, risk factor. So even with the same VO2 number, 2 people may have a different interpretation.
So age is probably the easiest way to kind of assess a difference with the same number. So if someone were to be 75 years old, 75-year-old athlete, and their VO2 max was measured at something like 40. And their grandchild, their 22-year-old grandchild, has a VO2 max of 40 as well. Well, they may go for walks together and feel great and enjoy that time together, but the prospects for the 20-year-old or 22-year-old may not be as favorable as one might expect for their age group. That's a potentially a low number, but it's also a favorable number for the 75-year-old. So I think that's kind of a valuable tool in the context of understanding someone's cardiovascular wellness or health, especially as we age, if that's a valuable example.
And going to picking up on the numbers that just you shared, they are not by chance shared like that, which correspond to 35 to 40 milliliters of oxygen per kilogram per minute, is actually a value that is associated with the highest, with the least, lowest risk of having cardiovascular and metabolic disease and disorders over time. So an individual that is young may have almost naturally a VO2 max of 40 just being recreationally active, but for a 60 years old person having a VO2 max of 40 actually requires a lot of work, but put both of them at low risk of developing disease. So over time, keeping the number high or growing the number as it should normally go down, it's an incredibly valuable aspect.
And so along those lines, the body composition and the capacity or efficiency of extracting oxygen is more efficient from muscle tissue than from fat tissue. So the assessment of the VO2 max, well, one of the quickest ways to improve your VO2 max is shedding excess adiposity or excess fat weight, lowering body mass also. When the calculation of VO2 max is made, it's the divisible value, or the denominator, that we divide the total number of flow or oxygen consumption is kilograms or weight. So it's a oxygen flow or consumption divided by weight. And as you shrink the denominator, the numerator, the top number, actually relatively increases.
Yeah. So we talked about in this episode about a few important things. First of all, VO2 max is not just a fitness number. It's a number that can tell us very valuable information, not only for athletes, but also to clinical population. So it's a health span number and a lifespan number as well. It tells us how well the heart, lungs, blood, and muscles work together, and it can be measured directly. It can be tracked over time to check progress, and importantly, it can often be improved based on the exercise that you're doing and the lifestyle choices that you make. So final thoughts. How would you close this, Dr. Kedan?
Very good. Thanks again, Marco. I'm excited to talk about VO2 max as a measure and personal measure of your overall cardiovascular fitness, and actually your prognosis as someone who wants to live longer, or your likelihood of being able to live a longer time. So personalizing your care and understanding and knowing your number is very valuable. And I would just say that's probably a central theme to all conversations regarding measurement of VO2 max. Know your number.
Yeah, so that's a perfect place to start. In episode 2, we will talk about why VO2 max testing belongs in preventive health and how it fits alongside numbers of patients, and how we can match that with cholesterol, blood pressure, glucose, and cardiovascular risk. So everyone, thanks for listening to Know Your Number.